This episode of Tolle Run is brought to you by Grandma's Marathon, the women's running San Diego half marathon and 5K benefiting the Edith Sanford Breast Cancer Foundation and MTech Results. Hi, I'm Olympian Carrie Tollefson, and today we're talking foot care for runners with Dr. Angie Voight. So let's get after it. I think the first and most common thing is a blister. How do you treat that without having to come in and see you after infecting it so bad or whatever that may be?
Well, one of the most important things would be to prevent it in the first place. So important things are having really good socks, more athletic socks, not a cotton sock where you're going to get rubbing. Making sure that you have a good fitting shoe, because that's the thing, you go run a marathon and do a long run in a shoe that doesn't fit and you're going to have blisters, and if you have bad socks on top of it, or if your shoes and socks get wet, you're going to get blisters. So if you can do some things to prevent it in the first place, that's going to be helpful. And then, you know, at the first sign of having a blister, if it starts to get painful and red, you could use something like a second skin or something to put over it so that you protect it. Even, you know, trying to do a Band-Aid or something like that, sometimes something a little bit thicker that's made for a blister helps a little bit more. If you have a huge blister that is painful and you need to pop it, you can sterilize, clean your foot, sterilize it with alcohol, sterilize the pin, hot water, alcohol. You can make just enough of a puncture to drain it out. Go ahead and drain it and then put an antibiotic ointment over it and cover it with a Band-Aid or cover it with something that'll protect it.
All right, Ange, my toenails are not pretty, especially after that marathon. So how do we treat black toenails and how do we prevent them if we can?
Well, if it's just black and it's not a blister underneath, a lot of times it's from trauma, just your toenails hitting your shoe. So if you have a shoe that's long enough or even a little bit bigger, if you find that you're always getting your toenails black, a lot of times it's just the trauma of hitting your toes at the end of your shoe. So if you have a big blister underneath, it depends, because the pressure can build up and can get very, very painful. And if that happens, you probably want to go into a clinic and see somebody to have them drain it out, because you don't want to drill through your toenail on your own. If it's just black, you know, if it's a small blister, you can leave it. You can try to just protect the area, you know, again, using something over it, whether it's athletic tape, if it's just a second skin product, or just something to protect it, that's going to help a little bit.
So the third thing that we kind of are always trying to figure out is plantar fasciitis and Achilles.
Yeah.
And you have some tips for us on that, don't you?
Well, a couple of tips. They're tough problems, and part of it is just trying to monitor your training so you don't get to the point where you have terrible pain either with your plantar or your Achilles. But some easy things you can do, you can always do stretches for the plantar fascia, stretches for the Achilles, where you really try to stretch out your calf, because tight calves can play a part. And but just if you have some mild discomfort, you want to try to just protect the area a little bit. One of the things that you can use is something like a kinesio tape or KT tape. They have all different kinds, and it's pretty easy to find a video on how to tape, and you can figure it out on your own. But it is a nice thing to have, just so that you have a little bit of protection. It helps with some soft tissue alignment and can help with the pain. So something like that can be really helpful.
Well, thank you. I hate plantar, so
I know. It'll take you out for a long, long
Achilles,
time sometimes.
I've been lucky enough not to have a real long stint of that, but that's a rough one too. So kinesio tape is a good thing to have.
Yep.
Nice.
Yeah.
Thanks for joining me for Foot Care for Runners. Say that 10 times really fast and get after it.